epithelial linings of the major organs. In a sense, we humans are a bunch of sacs and tubes. That's how we're formed. And the linings of these various sacs and tubes have to function as good barriers between the bloodstream and whatever the compartment is that that organ or tissue defines. When that lining becomes leaky, all kinds of morbidity and sometimes mortality ensue from that. The best recent example was COVID and the accumulation of fluid inside the lungs of certain COVID patients. That fluid accumulates because the linings, like diagrammed here, if this is the lining of the airways, these junctional seals between the cells become leaky and fluid moves from the bloodstream into the space defined by that tissue or organ, in this case the airways. And then accumulation of fluid in the lungs is what basically puts a patient in the ICU. Vitamin D was particularly good at tightening up these seals. And that sort of rings a bell in my head that vitamin D, the clinical picture, vitamin D was definitely a good guy in COVID morbidity. One of the strongest predictors of a bad outcome for someone who contracted COVID was if they were vitamin D deficient going into the illness. If that was the case, it was right up there with obesity, diabetes, except that a vitamin D deficiency is so easy to correct or alleviate. It would just be a vitamin D supplement. Simplest, easiest thing I would have done nationally and internationally would have been to put everybody on a vitamin D supplement. We feel strongly that it could have reduced the morbidity associated with a COVID illness. It's not going to prevent it. It's not going to reduce your chances of getting it, but if you do get it, it should reduce the severity of the illness, maybe keep you out of an intensive care unit,